Let's learn about first mechanism of labor, which is called as engagement. Okay, now what is engagement? So engagement means attach. Okay, but attach between what? It is attachment between fetal head, okay, fetal head and pelvic inlet part, means first means covering, okay, creasing part of pelvic, maternal pelvis. Okay, so now let's define first mechanism. It is a point when the widest part of the baby's head. Now what is a widest part and when and where? So when labor begins, so the widest part of baby's head means fetal head, which is typically known as biparietal diameter. As we have learned bones regarding skull, okay, and in obs gynec you should learn about fetal skull. So there is a first frontal bone to parietal bone and occipital bone, and here are the sutures, okay, so sagittal suture, longitudinal suture, okay, lumbar suture. Here is a bregma is the anterior fontanelle, okay. This suture and these two sides create a distance between two parietal bone and the covering area of fetal head. This distance between two parietal bone create a such diameter which is known as a biparietal diameter. It is the widest diameter of fetal skull. And now this biparietal diameter and this two parietal bone lies now at inlet area, means pelvic inlet area. Then this engagement happen, means fetal head attach with inlet area. Okay, as I have already told you, the baby's head or the presenting part. Okay, what is a presentation? Presentation is a cephalic, cephalo means head, and the vertex part. Okay, and the in engagement the areas start to change. Okay, now engagement is not completely straightforward. Okay, first occiput area comes anterior, then goes posterior, then parietal bones come at downwardly superior side. Okay, so there is a twisting mode. Okay, but that's a different topic. Okay, we have to focus on what is engagement. So that parietal part, okay, in vertex presentation, sorry, cephalic presentation, cephalo means head, and the presenting part is a vertex. That presenting part, the feet of fetal head, when reach the pelvic inlet, as you can see, this one is a inlet area. Okay, this one is a pelvic girdle, two hip bones made from three bones, ilium, ischium, pubis, ilium, ischium and pubis. So these two ilium bones make the covering line superiorly, that the crease circular side, which is known as an inlet, called as a pelvic brim, and that baby's head in which vertex presentation. Okay, if presenting part vertex, okay, that vertex side in cephalic presentation, that head part biparietal diameter when comes in a inlet portion, okay, and cover all the creases of brim and reach to fetal station. Okay, what is fetal station? It is a distance between ischial spine. This one is a S shape. Here at ischium side there is a S shape which typically lie at posterior side. If you have learned about maternal skull, or you know the anatomy of pelvic girdle, so you know this very well. Okay, so if you want to learn about fetal station, you can comment. So that fetal station, the degrees of fetal head reach during the labor time, okay, that is a fetal station. That midpoint, it is a 0 degree, from upward minus degrees, -1, -2, -3, -4, -5, and downwardly +1, +2, means -1 to -5 upward, and downwardly +1 to +5, which shows the fetal head engagement on the time duration of between labor, okay, during the labor. So this fetal station now completely cover by starting point -5 degree, -4, which is called as a incomplete engagement, but the starting phase. Now it comes -3 to -2, okay, that is a partial part, and then fetal head reach 0 degree, that is called complete engagement. So there are some basic level, like from the pelvic floor to inlet and in between pelvic cavity, there are some stages of engagement, like 5/5 still high, 3/5 partially, 1/5 or 0/5 complete. Okay, when baby's head reach 3/5 or 1/5, mother typically feel downward fetal head felt at the pelvis, which is called belly drop experience, like female feel something high, okay, towards the at belly side, lower belly side area, which is referred as a pelvic part most of. So it occur when before labor begins specifically, but as I have already tell you, this will occur during the labor time, especially in a second stage of labor, okay. But in a primary mothers, which the female who experience first time of delivery, they happen this most of. Why? Because of good uterine tonicity, good elasticity of whole birth canal, okay. So basically it is a very crucial step process, like it is a navigation that now baby is ready to deliver, okay. So how we can identify between engage and not engage? So as I told you before, transverse biparietal diameter when head comes in a contact with inlet but not covering a proper ischial spine, S shape, okay, that is called not engage. But when it completely touch with ischial spine and comes fully in a contact with, where? At ischial spine, pelvic brim area, and totally covering of biparietal diameter, that is a 0 degree fetal station. In short, now engage happen. So basically what is engagement? Engagement means these two parietal bones create a biparietal diameter. This biparietal diameter comes in a contact with pelvic inlet area. That pelvic inlet area cover with fetal head part, widest part, and touch and cover ischial S-shaped spine, 0 degree fetal station, which is called as a engagement. Engagement is when these two biparietal diameter, okay, comes in a contact with inlet and cover the whole ischial spine at 0 degree fetal station level. These two parietal bone comes direct contact and attach fixation part, fix with inlet, that is called engagement. In next lecture we will be learn about stages of engagement and other mechanism of labor. Till then, happy learning. I summarize what is engagement. It is a point when the widest part of baby's head or fetal head, means biparietal diameter, typically, okay, I already told you, enters the pelvic inlet area brim at the time of labor or between the labor, which is engagement, a crucial part of labor.